As per the World Health Organization, this Omicron variant of the current COVID-19 pandemic virus is considered to have a higher risk of transmission. Therefore, it can spread from one person to another person much easily than the pre-existing variants. In addition to this, Omicron variant are capable of escaping the immune responses of the human body, and it is also capable of causing an increased chance of reinfection in a patient who has already been vaccinated or patient who has already been affected with COVID-19. However, the severity of the infection caused by this variant of the virus is still unknown, and existing data are inconclusive. So with evolving time, we will have more understanding about the severity of this virus. But as of now, we know that this virus can be easily transmitted from one person to another person, and it is associated with a high risk of reinfection in patients. And there are also reports that few of the young patients are affected by this Omicron virus, and this is very important because in India, even now, most of the patients have not completed their second dose of COVID-19 vaccination, and even children are unvaccinated. So it is of very high importance that proper containment measures are taken to avoid the spread of this Omicron variant of COVID-19 pandemic virus.